Recording. That's recording there. Cool. Okay. Alright, wash your hands. Hi, my name's Kelsey. I'm from ambulance. What's your name?
Sarah.
Sarah, what's happened today, Sarah?
I stood up, got really dizzy, and I think I may have passed out.
Okay, that's no good. What were you doing at the time?
I was just sitting down watching TV and went up to go get some water. And then when I stood up, I just got really dizzy.
Okay.
So I sat down again, and I think I passed out. I don't really remember.
Okay, so you sat down. Don't think you hit your head or
No.
your neck's not sore, don't have a headache? Okay.
No.
I'll just put this on and check your blood pressure and do all the standard things.
Yeah.
Okay. And you didn't have any chest pain or nausea, palpitations, like a feeling your heart's going very fast or anything like that?
No.
No? Cool. Alright, that's good. And have you been feeling well otherwise today?
Oh yeah, mostly. I've got a bit of a sniffly nose.
Oh, okay. That's no good. Do you know if you had your COVID vaccinations?
Yeah.
Okay.
Vaccinations.
2 or 3? Oh, 3.
Three.
Okay. Awesome. I'll just pop these on your legs. So these conveniently placed ones. Have you got any medical history?
No.
No. Okay. No history as a kid. One
No.
hospital kid or anything like that.
No.
Okay. Cool. And not any regular medications.
Just the pill.
Okay. Oh, my timer's turned off. Let's turn that back on. Okay. All right. Okay. So you haven't started the pill recently. How long have you been on it?
About 3 years.
Okay. And when was your last menstrual period while we're on the topic?
About 2 weeks ago.
Okay. All right. Okay. Was that normal?
Yeah.
No chance you could be pregnant, you reckon?
No.
No. Okay. Okay. So I'll pop these on. Have you had an ECG before?
Yeah.
Okay, so these just go around your left breast.
Yep.
The first two will just go from the top. I'm not going to do that because I haven't paid you enough as a volunteer. So we'll go down, 4th intercostal space, either side of the sternum. 3 will go in between 4, which will be sort of just like 5th intercostal space, mid clavicular, and then 6 will be mid-axilla, the same intercostal space, and 5 in between. So we'll print that off and have a look at it, and we might as well talk about that now before I forget. While we're waiting for that to print off, I'll check your temp and check your VGL, because these are things really fiddly, so we'll pop the thing in, prick, and do that, and then we'll get one of those cotton swabs that are really nifty. And those are all pretty unremarkable, as the ERF shows. Your afebrile and your BGL is pretty good. Okay, so that's the ECG should hopefully be ready by now. And that shows normal sinus at the rate that's the same as on the monitor here, which is just around, I think it's 80 on the case sheet actually, so it's about 80. There's no PVCs, I haven't noticed any ectopics, normal axis and amplitudes are all looking pretty good in terms of nothing like hypertrophy lines or anything like that. No, oh, that's not, that turns off. Do you smoke?
No.
No. Do you drink alcohol?
Not much.
No. Every day? Not.
Yeah, probably one a day.
Okay, alright. And any other drugs, substances?
No.
Definitely no IV drug use in
No.
the past 6 months? Cool. That's what I like to hear. No history, because we're on cancers, no history. You haven't had like a strep throat infection. You remember something like it sounds like acute rheumatic fever or something like that. I don't know if you've heard of that
No.
or as a kid. Cool. Alright, that's good. Okay. So, you said that has this happened before? This
Yeah. So maybe like twice in the last year or so. I've talked to my GP once.
Okay. Is it similar each time? Like, is it what happens each time?
It's just been dizziness. I've never gotten to the point of almost blacking out, but
Okay.
that's why I called you today.
Yeah.
But
has it happened when lying down? Like,
No.
Or is
No.
it when you stand up?
It's just when I stand up.
Okay,
Yeah.
alright, okay. And you said you've been a GP and you
Yeah.
sort of started to talk with them.
Yeah.
Has it been happening more frequently recently?
Yeah. Yeah.
Okay. Alright. And have you been up, how your water intake, how's your water intake been
Yeah,
today?
good.
Okay, I'm gonna pinch your, okay, can you stick your tongue out? Obviously I have to thank you, yep. Not looking too dry, our turgor is good. And food intake, is that, how's that?
Yeah, it's been fine.
Okay.
Yeah.
Alright, okay. So I suppose I should narrate that my general impression is that we're looking not cachetic with no cachexia. Colour appears, we're not jaundiced, and vital signs as appear, they're not too scary. So what we might do is we might do the postural BP now, and that just see, sometimes when you stand up and you get really dizzy, your blood pressure might drop, and that's just something really quick to check. And then I'll have a listen to your lungs and your heart, if that's all right with you.
Yep.
And then we'll just have a quick feel if your heart is, if I can actually feel your heart, which, yeah, anyway. Yeah. Anyway, so we'll do that.
Sure.
So it's just standing up when you're ready, and you've got the bed behind you, so if you need to, if you get too dizzy, please sit down, don't actually fall over, that would not be too good.
Yep.
We're still recording, cool. Alright,
Standing up.
so now I normally wait a minute or 2 minutes before we check, but we've got we're at 111 at the moment for our pulse rate, so that's quite a significant jump. And I'd start with that BP at that 2 minute mark. But for the instance of time, or for the time constraint, we'll just skip ahead. And we don't really have too much of a posture drop, but we did have a bit of a tachycardic response. Okay. So, I might have a listen to your lungs, and then we'll get you lying down if that's all right.
Yeah.
So just breathing deeply, but at your own pace. Alright, and how are you feeling after standing up?
A little bit dizzy, but
Okay.
it's getting better.
Okay,
Yeah.
alright. I'll take that off just so we don't get too tangled if you ever lie down as well. Turn my trusty timer on. Okay, so first of all, have a listen to your heart.
Mhm.
So we'll try and get to that, the intercostal space, the aorta. Just had a bit of trouble lifting a mitral valve, but everything's down. Dual heart sounds, no murmur, and I'm not really smart enough to be able to tell you what the murmur would be. But I'm not hearing a murmur, so that's good. That's good for sure. So we'll have a feel for, I guess, a heave or a thrill, and that's just your apex. So I'm just going to try and feel where my step was, so just here. And we'll just see if we can feel a heave or a thrill. And probably do that with the shirt further up, but I haven't paid my volunteer enough. Okay, so, and then we'll have a feel of your belly. And I could also feel for an enlarged liver. And Any pain? Any pain in your, no?
No.
That's good. No shoulder pain? No, because I guess ectopic pregnancy would be the concerning thing there. You haven't had a history of clots or anything like that in your legs?
No.
Okay, alright. And have you been feeling short of breath or?
No.
Definitely no chest pain, you were saying, hey? No. Okay. Are your lower legs? No pain and swelling in your lower legs?
No.
Okay. And if I was thinking of a DVT, sorry, I could measure the cast because I suppose the discrepancy of more than 3 centimeters, I think, is would be the concerning factor there more so than pain. Okay. All right. So. All right. So we'll get you sitting up again. We might as well just do a quick neuro, just to have done that as well. Could you take your mask off? Sorry. And my neuro torch appears to just want to run and hide from me, so I'm going to have to pretend, but because it's literally gone somewhere, I have no idea now. But yeah, so we're 4 mil, and like we did in the rehearsal, the brisk at 4 mil. Okay, could you raise your eyebrows up? Thank you. Stick your tongue out straight. Alright, puff your cheeks out like a pufferfish. Alright, thank you. Okay, and a big cheesy smile as well. Thank you. Alright. So what I'm going to do is we'll just get to prenatal drift. So if you imagine you're holding a platter plate, so just like that, and close your eyes and just keep them there. I'll just keep them there for a little bit longer. Okay, fantastic. Alright, so if you give my hands a big squeeze, pull me towards your head, push me away from your head. Alright, and then I just won't, because we're not really thinking straight, we won't actually go through all the arm movements. We won't look at dysdiadochokinesia either. So yeah, we're not thinking of that. And your balance was good when you were standing up for that period of time. We could do a Romberg study, I suppose. Were you feeling okay when you were standing up? Were you able to stand for a period of time?
I felt really quite dizzy.
Okay, alright. So we might just skip that then. Now, I'd really recommend that we go up to the hospital, especially if this hasn't been investigated to the point where your doctor's saying, you know, this is definitely POTS or this is definitely this or that. And in the absence of that solid diagnosis, and I suppose that you're only, did you say your GP appointments are only
every like 3 months or 4 months.
Okay, so that's not so great. So I'd really recommend that you go see the hospital today. And the way what the biggest thing they'd probably rule out would be if there's some electrolyte derangement or anything like that. Do you have any family history? What's your family history like?
Just I think my dad has like angina or something. And like my brothers and sisters just have some mental health stuff, but
okay, alright.
Otherwise there's not really anything I can think of.
So no history of cholesterol disorders while we were really young?
No.
Yeah. And then I could also look for, have a quick look for like Arcus or, and hopefully would have picked up on some cholesterol deposits at this point, but they are quite prominent. They can be prominent in the mouth. So you can say R again, and I'll use my torch, which I've misplaced. Okay. Alright, so no history of like a family member quite young who's collapsed with cardiac arrest at quite a young age, or nothing like that's happened? Okay, alright. So yeah, I'd still recommend that if we can't say that, you know, if the GP hasn't said that it's POTS or anything like that, really recommend that you go up to the hospital. Is that?
I'd rather not go today. I've got some things that I need to do today.
Okay, alright. Yeah, the tricky part is that we can't, if you can appreciate it, because I can't say what it definitely is, that makes us all a bit nervous. Okay, alright. is it possible, at the very least, if I could try and get a GP appointment for you?
Yes,
See
yeah.
if
I'd be
today's-
happy to go to the GP in a couple of days or something.
Okay, fantastic. That would that'd be better than nothing. So after in a few minutes, I'll give them a call. We'll just run through some few things that we really should talk about now. If anything changes, specifically if you get chest pain, if you get palpitations, or your breathing it feels like it's hard to breathe,
Yep.
or especially if you feel quite dizzy or you pass out while lying down without that standing up period. If that happens when lying down, that's quite a significant red flag,
Yep.
and I'd really urge you to call another ambulance.
Yep.
Or if you change your mind or you have another concern, please, you can go to ED or call us back.
Yep.
Unfortunately, I won't be able to write the GP a letter, but in Queensland, but I can try and call them.
Yep.
And see if that. So that's what I'll do in a minute.
Yeah, that's fine.
Do you have any questions, concerns, queries, anything?
No, that's all good. I
Okay.
understand that. Yep.
Alright, okay. Sounds good. Alright, I'll go make that call now. Oh, where's the button?